While I was in my residency at Rutgers, which was UMDNJ, a lot of my now mentors were my faculty. They were really pushing to have this protocol or this LANAP incorporated into the residency training, and it was crazy because nobody was doing it at the time. So I had a few introductory courses by, trained clinicians, and they started telling us all about the LANAP, which kind of piqued my curiosity. But unfortunately, I graduated before it happened. So after I finished, I still had it in the back of my mind. So I was really curious, like I said before. So I looked into it, and I decided to just take the plunge and come and see what it's all about. I was totally skeptical because what they were telling me went completely against what I was trained to do. It just was impossible to just grasp my mind around what they were saying was the results, how the protocol was. So absolutely, I was very skeptical. I really wasn't buying into it. So that was my mentality coming in the first, time at boot camp. I've done cases, and wow, I mean, it's truly amazing. It's cutting edge in periodontal treatment for patients that have this disease. I recently treated a case where it was referred to me basically as a hopeless tooth. And I told the patient, who had a history of previous bone grafting and traditional surgeries, and we're still back at square one. So I told her, listen, you have nothing to lose. I mean, this tooth is pretty much deemed hopeless, so let's just try it. And honestly, I was blown away by the results, going from grade 3 mobility to grade 1 mobility, reduced pocketing. It's just beautiful, healthy pink gingiva that we strive to achieve with all our patients. So amazing. So patients also are a little bit skeptical at first because they're under the impression they've been seeing their general dentist for years and years, and even those that have disease that have been maintained, they know that traditionally if they need surgery, it hurts. It's painful. It's not fun. It really takes a lot of time out of their daily lives, and they really have to kind of prepare mentally for it, which kind of puts off a lot of patients from seeking treatment. So when I tell them that there's no cutting, no stitching, the downtime is virtually nothing, and there's really minimal to no discomfort following this protocol. Again, they're a little skeptical, not really believing me, but for the most part, I'm really thankful that they trust me enough to go through with it, because afterwards the first post-op was, wow, I can't believe it. I wish I would have known about this years ago. I would have gotten treatment done way before. It was great. As far as the training, I mean, I think it's put together very, very well. It's a very organized program. Yeah, it's a little intense. You come, that's why they call it boot camp, the first 3 days, because it's pretty intense. It's 3 full days of ongoing training, but it's very important that you learn everything there is to know from the founders and those that have been doing it for years and years. And the best part is that those people are there to help you, which I really do appreciate. And it's really nice to have that support system, because yeah, you come here for a short time and then you go back and you're kind of like, okay, now what? But it's very comforting to know that there is support whenever you need it, and that they're willing to help you succeed. Do it. What are you waiting for? Honestly, like I said, I was skeptical at first, and I take my words back. It's truly amazing procedure, and it is cutting edge in therapy as far as treating periodontal disease. And as a periodontist, I've done all the traditional training, and this is by far my standard of care for treating perio patients.